Hello everyone, my name is Yared. I'm a dermatologist and department head of one of the youngest dermatology residency programs in Ethiopia at Araba University. In the next few minutes, I would like to take you to our short journey, the factors, our success and failures, and to the most important thing, to the future hope of dermatology in Ethiopia. I declare no conflict of interest. When we see the current status of dermatology in the country, there are around 205 dermatologists in the country, with around 80% of them are located in the capital city. When we see the ratio, it's one dermatologist for 600,000 individuals in the country. Even to reach the WHO's recommendation, we have to have more than 20 times higher number of dermatologists than we have now. And it gets worsened when we see the eastern part of Ethiopia, where I am working now. There are around 11 dermatologists for more than 34 million people, and making the ratio of one dermatologist for more than 3 million individuals. Reflecting on the statistics and realities in my country, Ethiopia, where millions are still deprived of proper skin health, dermatology is not a luxury. It is an essential service that must be expanded. And I strongly believe that training experts in the field is the key in improving access to skin health for everyone in this country. When we see the short story of dermatology residency programs in Ethiopia, it was initially initiated in 2005 by Addis Ababa University, and it took us more than a decade to start the second and third residency programs at GONDAR and Mekonnen University, and followed by Bahar Dar University, which was initiated by our colleague, Professor Wondermage. And fortunately, I was the first batch of Bahar Dar University, followed by St. Paul. And on 2023, me and my colleagues initiated the Harama University residency program, and we accepted a total of 4 residents initially, and now a total of 10 residents. When you go to the Harama University Dermatology residency program, the driving forces to start the dermatology residency program was high burden of skin disease in the community, and there was a progressive increment in number of dermatology cases at the institutional level or at the university hospital. And despite the increment in cases, there was a low number of human resource with additional staff migration to the capital city. And the other major issue was the university's plan towards excellency and autonomy and assuring a best service for the community. When we see the timeline, official planning was started on November 2022, which includes the fund allocation, curriculum revision, human resource allocation, and infrastructure preparation, followed by the accreditation process by the regulatory body with a team from the Ministry of Health and Ethiopian Dermatology and Venereology Society. It was assessed twice on December 2022 and March 2023. The first time it was declined due to some factors, and which we'll see it later. And we initiated the residency program on May 2023 after the accreditation at national level. When we see the opportunities that helped us to start residency program, the first and the most important one is for our success is the commitment of the leadership, especially at the college level, in allocating funds and hiring more dermatologists for the program and preparing the teaching and the clinical setup. And the other one is the available setup that has been used for the past 1 decade, and including the OPD and some diagnostic and therapeutic materials, and followed by the presence of the national harmonized curriculum for dermatovenerology. It makes it very simple for us to adapt this curriculum to our setup. And the other one opportunity I used personally is communicating with the GLODERM family. I would like to thank Esther Freeman for connecting me with expertise in curriculum preparation. And when you come to the challenges faced before we start the residency program, the first one is regulatory and accreditation. As I've tried to mention earlier, it was denied on the first time on December due to the low number of patients to start residency program at the university level. And we tried to sign an MOU with BCDMO Hospital or Leprosy Relief Center BCDMO. And the other is we tried to announce for the community that we have started dermatology program and with a better diagnostic and therapeutic materials. And the other one is during the curriculum revision, there was we were less experienced, and we tried to communicate with the university higher officials, and formal curriculum committee was formed, and informally we have been discussing with national and international experts. And even though we have still limited funding, some was resolved at the university and the college level, but still we have limited funding on different, especially on the therapeutic materials. And the other one challenge was a limited number of faculty members, and more dermatologists were hired, and now we have 5 faculty. After the accreditation of our curriculum at the national level, we made a radical change in the teaching and clinical services. We simultaneously started the program at Harama University and BCDMO Hospital together. And at Harama University, Yotfana Comprehensive Specialized Hospital, we accepted 4 residents on May 2023. And on the service, we added 1 pediatric dermatology OPD, and we increased the number of OPD days from previously it was 1 day in a week to 5 days per week. And we also organized the dermatology procedure room, starting electrocautery, cryotherapy, UVB therapy, and laser therapy. But still there are some interruption on these procedures. And the other one is we organized a seminar in the teaching room to facilitate the teaching process in the department. So as agreed on the MOU with BCDMO General Hospital, Karama University donated some OPD furniture and diagnostic tools, and our residents started a clinical activity 3 days in a week, and initially it was 1 OPD and later added 1 more OPD. When you see the impact seen in the department, our residents have seen more than 10,000 cases in total in both hospitals, starting from the simplest and commonest tinea up to the rarest types of xeroderma pigmentosum cases. We have increased the interdepartmental consultation, and beyond border, beyond Ethiopia, we have accepted 1 resident from our neighboring country. So, and beyond the clinical and the teaching activities, our residents have been participating in different community dermatology services, including screening at the prisons, orphanage areas, in elderly houses, and celebrated the World Leprosy Day twice. And when we see the current challenges, we have some limited funding to expand the inpatient and OPD services, and we have limitation on dermatopathology and dermatosurgery short-term trainings, limitation on dermatologic medication, open access educational resources, and more international collaborations are needed to progress this program. When we see the external supporters we have got so far, the first one is with the donation from Professor Ondemage in Dhaka University. We accepted more than 150 histopathology slides for basic dermatopathology training of our residents. And the other is the Emerging Residency Program Network, initiated and chaired by Claire Fuller. We have discussed about dermatopathology, surgery, and pediatric dermatology, generally on residency program capacity building. So I believe the future of dermatology network. አመሰግናለሁ. Thank you so much for your attention.